The role of mitochondria extends far beyond the metaphor of power plants. They participate in fatty acid oxidation, glucose metabolism, and cellular signaling, ensuring that energy is distributed with precision throughout the body. When this system falters, metabolic balance unravels. This breakdown lies at the core of common disorders such as diabetes, obesity, and cardiovascular disease. Diabetes offers a clear example. In type 2 diabetes, skeletal muscle often exhibits reduced mitochondrial density and impaired electron transport chain activity, leading to decreased ATP production. This undermines insulin sensitivity. Muscle cells cannot efficiently absorb and utilize glucose, leaving blood sugar chronically elevated. Moreover, mitochondrial dysfunction promotes the accumulation of lipid intermediates such as diacylglycerols and fatty acid derivatives, which interfere with insulin signaling and accelerate insulin resistance. In obesity, mitochondrial dysfunction is both consequence and cause. As adipose tissue expands, mitochondria face sustained energy overload, generating excessive reactive oxygen species. This oxidative stress damages mitochondrial DNA and proteins, further impairing function. As efficiency declines, energy expenditure drops, making fat accumulation even easier, a vicious cycle of weight gain and metabolic deterioration. Importantly, mitochondria in brown adipose tissue are responsible for thermogenesis. When impaired, heat production falls, further tipping the balance toward energy surplus. The heart underscores mitochondria's centrality even more vividly. Cardiac muscle cells are densely packed with mitochondria, as the heart requires continuous energy for each beat. When mitochondrial function fails, ATP supply falls short, leading to arrhythmias and impaired contractility. Studies reveal that patients with heart failure often display reduced respiratory chain enzyme activity, unstable mitochondrial membrane potentials, and excessive calcium accumulation, all factors that compromise cardiac output and heighten the risk of sudden death. Together, these findings highlight a central truth. Mitochondrial dysfunction is not an isolated defect, but a unifying mechanism across metabolic disorders. Energy deficits disrupt glucose, lipid, and protein metabolism, while oxidative stress and aberrant signaling drive further decline. This explains why patients so often suffer overlapping conditions, diabetes coupled with obesity and cardiovascular disease. Recognizing this reframes how we approach metabolic disease. Managing blood sugar or body weight is not simply a matter of external numbers, it reflects whether the body's energy factories are functioning properly. Without restoring mitochondrial health, even strict diet or pharmacological control cannot fully halt disease progression. Thus, the future of metabolic medicine must look inward. Interventions that enhance mitochondrial efficiency, reduce oxidative damage, and stimulate mitochondrial biogenesis represent not just supportive measures, but potential breakthroughs in combating the hidden costs of metabolic imbalance.